Hello friends, it's me, Playto the Portsmouth plesiosaur. Today I'm back at the Queen Alexandra Hospital, Portsmouth, to learn about a tiny creature, a microbe that sometimes makes people poorly. It's called Staphylococcus aureus, or Staph aureus for short. Let's find out what makes it so sneaky. And to teach us, here is Dr. Ainthini.
Hi Playto, great to meet you. As you know, I work at the microbiology lab. We study bacteria to understand how they cause infections and how to stop them.
Wow, okay. So what's so special about this Staph aureus fellow?
Well, Playto, Staph aureus is actually a microbe that usually lives quite happily on our nose and on our skin. For most people, it doesn't cause any harm at all.
So it's usually a friendly house guest?
Exactly. But if that house guest sneaks into the wrong room, like through a cut, a wound, or a medical tube, it can cause trouble. That's when it becomes an infection.
So what kind of trouble can it cause?
Lots. Things like boils, wound infections, pneumonia, or even blood infections. And it does this using some clever tools. We call them pathogenicity factors or virulence factors.
Virulence factors? That sounds fancy. Wow, unusual word. What are they?
Let's start with how Staph aureus grabs onto us. It has tiny sticky proteins on its surface. Think of them like grappling hooks that help it cling to our skin or tissues.
Whoa, grappling hooks. Ooh, okay. Or could be like suction cups of an octopus or claws of a crab or lobster. Wow.
Exactly. Once it's attached, it can start to multiply and make a little collection. Sometimes it even makes a tough layer called a biofilm to keep it safe, like a tough shield.
Oh, biofilm and a tough shield. Ooh, very, very clever.
Now, when Staph aureus wants to cause disease, it uses toxins, little chemical weapons. Some toxins make holes in our cells, some destroy red blood cells, and others can confuse the immune system so it overreacts.
So that's what makes people feel sore or feverish?
Exactly. The toxins damage tissues and make the body respond with inflammation. That's redness, heat, and swelling. It can also release enzymes that break down skin and tissue, helping the bacteria spread further.
Like it's digging tunnels through the body like worms, eels. Ooh.
That's right, a tunneling invader. But Staph aureus doesn't just attack, it also hides. It has a slippery outer coating that makes it hard for our white blood cells to grab and eat it. It can even flip our antibodies upside down so our immune system gets confused.
Whoa, that's sneaky. So it's got tricks as well as weapons.
Exactly. It also makes special pigments and enzymes to protect itself from the body's defenses, like sunscreen for bacteria.
Wow, also I suppose like a pirate. Arr, wow.
That's a great way to picture it, Playto. But don't worry, our body and the treatments have plenty of ways to fight back.
So how do we fight this pirate jam?
That means washing hands properly, cleaning wounds, and using antibiotics carefully. In hospitals, we also make sure equipment is sterile and replaced when needed.
So hand washing really does make a difference.
It absolutely does. Clean hands save lives.
Wow. So, let me see if I've got this right, Dr. Savaraj. Staph aureus lives on us most of the time without causing harm. It can sneak in through cuts and tubes and cause infection. But it uses sticky hooks and strong weapons and clever shields to survive. But we can stop it with good hand hygiene and smart antibiotic use.
That's a perfect summary, Playto.
Thank you, Dr. Savaraj. Thank you to everyone watching. Remember, keep those hands clean and stay curious. See you next time for another hospital adventure with me, Playto the Portsmouth plesiosaur. Thank you.